Forced to work from home by your employer? Laid off or feeling depressed at home? Do you want to make money working from anywhere? We'll show you how to do it from your couch. It's time for another episode of the Work From Home Show. Coming to you from their homes in Austin, Texas and Tampa, Florida, here are your hosts, Adam and Naresh.
Hey everybody, welcome back to another episode of the Work From Home Show. I'm Naresh, this with Adam Schrader. Shout out to all our homies, homeboys, homegirls, home trans, all the work from homers out there. Today we have one of my favorite types of guests that we've had on this show, and that is another medical expert. This is Dr. Alejandro Badia. He's a hand and upper extremity surgeon at Badia Hand to Shoulder Center in Doral, Florida. And he's the co-founder of the Miami Anatomical Research Center, M.A.R.C. He's a best-selling author of Healthcare from the Trenches, an insider account of the complex barriers of U.S. healthcare from the providers' and patients' perspective. So Dr. Badia is a very renowned, well-known expert in his field, but what I love about him even more is he goes beyond just the medical jargon, which very few people understand. He goes beyond that to explain the system, the healthcare system. He's going to help explain this pandemic a little bit more. He's going to talk about his life because he really has an amazing story immigrating from Cuba to the United States. So we're going to talk about that. And this is just truly an inspirational story that is relevant to the times of today, post-pandemic. And I hope you'll get as much inspiration as I got learning more about Dr. Alejandro Badia. Welcome to the show.
Thank you, Naresh. Very kind introduction. Anybody who knows me knows I'm very passionate about trying to disrupt how healthcare is delivered. And I think the pandemic is actually helping that process in some way, and I'm happy to expand on that.
Yeah, and I should say that just to, I don't know if you know these individuals, but I grew up in Houston, Texas, and a friend of mine, her father's, I think, like the most well-known hand surgeon in Houston. His name's Dr. Melhoff, and one of my
Tom.
You're familiar with Dr. Melhoff?
Yeah.
He's the hand surgeon for the Houston Astros as well. So that's
right.
what a lot of people know, probably for most of the sports teams. But his daughter and I are good friends, went to school together. And then another good friend, he's just getting his career started. Maybe I'll connect you to at some point. But he's also a hand surgeon, did his residency under Dr. Melhoff and went to do his fellowship and now works in middle of nowhere. I think one of the Dakota, South Dakota or North Dakota, signed an amazing deal there, and I think that's a smart thing to do. In fact, for any med students or people in residency listening to this, I think that's a really smart thing to do, to go out to the middle of nowhere and sign a multi-million-dollar contract for like 3 or 4 years, and then after that, go where you want to go. Go to Miami, go to Houston, go to any other nice big city that you want to go to. But he's like the only hand surgeon there, I think. Maybe one of like two in
Well, I may know of him because I heard recently about somebody who was in the Dakotas. But I will, for your listeners, I will say that healthcare is transforming in that, even though I can't do surgery remotely, although I can tell you that in the future there are a lot of things we'll be able to do remotely, even surgically. But certainly a lot of my consultations come from folks, even in that area, from the Midwest, because of telemedicine. And the pandemic has increased the use of telemedicine, as you know.
Well, let's talk about that some more. So, by the way, my friend's name is Dr. Patel, Dr. Darshan Patel. But
okay.
Anyway, let's talk about, you said the remote telemedicine and how much it's picked up over the last 2 years, let's say. What do you think is the future of telemedicine, and what opportunities are there?
Well, because of the lockdown, which is when I wrote the book, by the way, I wrote 90% of the book during the lockdown. And what I also did a lot of is telemedicine particularly the more urgent things, because there was a short time when our walk-in orthopedic center wasn't even open. So the future lies in that people now geographically, or when for one reason or another can't come in to be seen, they can be seen by a variety of clinicians. In my field of orthopedics, we've been doing it for years, well before COVID. It's ideal for follow-up visits, meaning you go, whether you see your family practice physician or your gynecologist, your ophthalmologist, you might do a follow-up visit to understand the results of a test, to see how you're progressing, and to have questions answered, where you may not need a procedure or that initial physical exam. Even though you can do a lot, at least in my field, I can do a lot of examination through a video. So I think that we will see that this is going to be a stable part of healthcare delivery going forward.
Now I want to look at the healthcare system the way it kind of is today. We're in a system now that the doctors hate, the patients hate, everybody pretty much hates. How did we allow it to get to this point, and is there any hope at all on the horizon? I was really hoping when the pandemic started, I thought, this is going to force us to, reevaluate how we do healthcare. Whether or not you look at Medicare for all, I don't care about that as much as the fact that our society, tying it strictly to your job, left literally millions of people without healthcare because, when you lose your job, you're out of luck, and it's crazy unaffordable if you don't have a job. But I haven't seen much movement in terms of people actually changing the way that healthcare is given and all of that. So what hope do you have on the horizon?
Well, if you ask me about hope, that's a different question. The problem is, as my book talks about, there is no reason for the current folks who are entrenched and profiting from this to really change. The disruption has to come from the public. Frankly, what we're seeing now with it's a hot topic, but whether you agree or not about racial injustice, all of a sudden everybody's talking about this. I don't see that with healthcare. The problem with healthcare is we keep talking about who's going to pay for it. So Medicare for all. I could care less whether it's Blue Cross or Medicare. The point is that the way we deliver healthcare is incredibly inefficient. There's too many middlemen. There's too many steps that are unnecessary to put barriers between someone like myself and my patients. If we could change that, there would be so much money left over in the system to really care for the less fortunate. We always need that as a society, right? We shouldn't let people die in the streets, and frankly, we don't. The Europeans think that about us. We all know we have public hospitals. I trained at Bellevue. Down here in Miami, we have Jackson Memorial. You have that in Houston. So that's not true. But the problem is it's incredibly expensive.
Yeah. The problem is if you live, you can't pay for it.
Yeah. Well, that obviously there has to be these safety nets. But the point is that healthcare will be a lot cheaper if we look. Bottom line is right now there's a lot of people making money in healthcare who really know nothing about healthcare. I understand. I'm a capitalist, right? You said I fled Cuba. And I'm an entrepreneur, so I love this country. But we have to understand that a health insurance company, should make a lot of money, right? That's what they're in it for. Let's face it. But they should collect premiums, and they collect a lot of them, and then they should pay for care. Whether it be like your auto insurance or everything else. The problem is they've gotten involved somehow in actually doing the healthcare, interfering in the process. I understand that we should have oversight because there are people. I have colleagues who may be less scrupulous or maybe over-order tests, and they should be called out for that. But it shouldn't be that every clinician, every step of the way, has to go and jump through these hurdles. My staff is just burdened with making phone calls to get this stupid authorization number. Who needs that number, right? What you need is to be authorized to see the patient and treat them. Now, if you order something completely crazy, there should be somebody who can step in and say, hey, Dr. X, why, explain why you're doing this. But that's the problem is if we could eliminate all these middlemen and the bureaucracy and the hurdles, healthcare would be much more efficient and more cost effective.
I completely agree with you. I'm not of the Medicare for all camp. I do think that will end up hurting the patient. I have friends and family in Canada, for example, and if you have a problem, if you wake up one day and let's just say you're not breathing properly, it's like an 8-month wait list just to at least 8 months just to go see a pulmonologist or a specialty physician. If your kid has a cold or a flu, same thing. I mean, you pretty much have to self-treat yourself. You have to self-treat
you have to have like chest pain. You have to have chest pain.
And the ERs, the emergency rooms are completely overrun. And then on top of that, the physicians do get it. I have a lot of doctor friends, and they explored. I explored going there for graduate school and even living there. My friends have explored working as physicians there. The physicians get paid very well. But if you're seeing minimum 40 patients a day, at least, sometimes as much as 60 patients a day, that's crazy. And you're working essentially 7 days a week. Yeah, you might make good money, but where's the time to do anything? You're just constantly looking at patients. And look, that's another topic. I want to talk about Cuba, though, because I want to talk about your story, immigrating from Cuba. I visited Cuba, fortunately, during like the 6-month period that people from the United States could go do whatever they wanted there. This was in December 2016. Amazing trip. I still tell my wife, we were boyfriend, girlfriend at the time, and I still tell her, I say, that's my favorite trip because we're never going to visit a place. It's highly likely that we're never going to visit a place like that. And they have free healthcare. Everyone has access to healthcare. They actually have a very good healthcare.
Well,
people are very healthy.
I'd love to comment on that, though.
Sure, you're the expert.
So, a lot of it, one thing that communists are very good at is propaganda. I mean, you just have to look back at the Soviets. So that's why they have excellent sports, right? I mean, this makes them look good in the world's eyes. I can tell you, I know the physicians there. And yes, there's a rich tradition of doctors. So that's in the first 2 pages of my book. I talk about that because I come from a long lineage of physicians from Cuba. And I'm the first one in this country, obviously, having been born there. But I will tell you that they just don't have the resources. So what happens is, how can you really have great health care if the orthopedic hospital I visited in 2004, I went to a conference only because that way I could get the visa. So they were very surprised when I was at the airport, like, how did you get here? Because they saw that I was born in Cuba. But fortunately, the organization based in Belgium got me the visa. And I visited the orthopedic hospital, and they had a CT machine that was not working because they had a fire. So they had no CAT scan, and there was no MRI. Now, granted, 2004, MRI was still in the earlier stages, but this was not 30 years ago. And if you do not have an MRI in an orthopedic hospital, that alone tells you there's something lacking. Now, they're very good clinicians. There's a rich history, and they export that. So when I did a medical mission in Ghana, 2 of the orthopedic surgeons were from Cuba. And they were wonderful guys, but they were paying them about $50 a month and pocketing the rest of the money that the Ghanese government pays to Cuba. All right, so the doctors don't make the money. And I can tell you, because they don't make the money, they're not incentivized. They never walked into the operating room to see what me and my colleague from Switzerland were doing. Right, that's the second most expensive healthcare system in the country, in Switzerland. But you know what? You get what you pay for. So I can tell you, I was surprised these guys didn't come in and were at least curious to see what we're doing, because they had a lot of time on their hands. So that was very symbolic to me. So don't get fooled by in these systems. They love to tout the healthcare for all, but frankly, I'd rather get healthcare in Canada. I mean, if you can access it. But I talk about this in my book. So in my book, I talk about Canada specifically, and I talk about another country that actually has a very good healthcare system with private insurance companies, but they're non-for-profit. So it's a different mantra. They're not answering to Wall Street. And I won't tell you who that is. That's in the last chapter of the book. So I'll leave that for your readers to look up healthcare from the trenches.
Yeah. Well, talking about Cuba again, look, it was a fascinating trip, and you're absolutely right. I misspoke because when I said they have a good healthcare system, it's the machinery, the equipment is like from the 60s. So you're right. They don't have the testing and the technology that you're going to get down the corner at your local hospital. But I think a major reason, and this needs to be talked about because we talk about health and wellness a lot on our show, especially when you're working from home and it's easy to eat junk food and not exercise and not go outside. And that is taking responsibility of your own health and preventative care. And what I saw in Cuba is my wife and I went to the grocery store because we're staying at an Airbnb, and it was hard to find a lot of junk food. You go to a store here, a grocery store here, and I mean it's junk food galore, even processed food. And so there in Cuba, it's a communist nation, and I'm not saying the United States needs to, clamp down on McDonald's and fast food and all that. I believe we as individuals are responsible for our health, and we take on that risk knowing when we go to McDonald's or I love Taco Bell, right? But I know that when I eat out or when I drink alcohol or I don't smoke, but when I do these things, I am responsible for my health, and it's not the government's job to overrule that. And now in Cuba, it does seem that a lot of the bad food that we get here in the United States, you're not going to find in Cuba. And I think that has more to do with the mortality and with the propaganda that you hear about their healthcare system, even more than, the doctors or the technology or the hospitals or the equipment.
Yeah, there's no question. I mean, in this country, we need to move to a better preventive health. And I'm reading a book now called Unconventional Medicine. And people think, oh, wow, I have an allopathic medical education. And people think that, us physicians don't care about or we don't believe in, holistic medicine. It's nothing farther from the truth. I mean, there has to be a good combination. So I love the way the conversation's digressing to really healthcare in general. It's because you're right. We do need to fix this. But I think that what's happening with the pandemic is it is a reset in many industries. And I think in healthcare, we should take advantage of that because there are some really good things that are happening now because of it. And certainly we don't have to be neither Canada nor Cuba, but we can improve. And a lot of that is through technology. I think we have to embrace technology. We have an app. One thing you didn't mention about, I'm the most proud of in a way, is I'm the founder of Ortho Now. Ortho Now is a network of orthopedic walk-in centers, kind of like all the urgent cares. I know you have a ton of them in Houston. And when I spoke to a colleague there, he didn't seem to understand it either. I said, and he's an orthopedist, I said, realize that most of your patients, when they come see you, they've been to one of these urgent care centers. And the problem is they don't have the expertise in orthopedic care. Just like I was an ER doctor at a VA, believe it or not, in Manhattan, but I don't know a lot about the eye. So when a patient came into me with an eye problem, I was immediately calling the ophthalmologist. And it's the same with orthopedics. You cannot expect even an ER to understand, why you have your shoulder pain or the subtleties of a severe ankle sprain, which one needs a cast versus a walking boot versus a ligament repair, or just Advil and ice. These are very sophisticated decisions. And our healthcare system has to move towards that, of getting what I call the right specialist at the right time. Both are important. The initial clinician who knows how to treat your problem, and then at the right time, meaning don't delay. When most of the patients see me as a hand surgeon, I'm the third doctor they're seeing, or fourth. That doesn't make any sense. All those other people were paid, right? So that's adding to the healthcare bill of this country.
Yeah.
But it's also delaying care. And delaying care impacts it, because all of a sudden an ankle sprain that was severe maybe should have been fixed a month ago.
Yeah.
You see the
it's
difference?
A hidden premium.
And that has exactly. And that has a really that has an underlying cost that nobody seems to be speaking about.
Yeah, well, I want to make some clarification. So I'm now closer to you. I'm in Tampa Bay now. I grew up in Houston. Adam's now
great.
in Austin, but we both met in Houston 12, 13 years ago. And going back to Cuba, when we were there, I was told that the doctors there make $14 a day. Maybe it's more than that now.
No, I think I think it's actually less, but it depends on what you hear. But yes, they
okay.
I mean, they make they the problem is they're going into disruption now because there's a dollarized black market, so people use dollars, and then the Communist Party, which was now handed over from Raul Castro to the current president Duque, and so nobody knows what's going to happen in Cuba. It'll be interesting to see what the Biden administration does.
Well, $14 a day. That's when you hear that's wild. And when we went there, the people who were like here in the United States, I'm Indian, all right, and it's like your parents tell you from the time you're born, you're only going to become a doctor. I'm not a doctor, my wife,
right?
But you're in Cuba, and what I noticed, and one of the waiters told me, they said, "Oh, if you want to make it here, you have to become a waiter. You learn how to speak English and you become a waiter, because you guys coming from the United States and UK and all around the world, you guys come here and you tip us U.S. wage. You tip your 10%, 15%, 20%, and we're making more money off a tip than what a doctor is making in one day." And I was like, "Whoa!"
Oh, yeah.
Like you grow up.
Well, it's very shocking. It's very shocking. I mean, they're most of the taxi drivers are. Well, they train too many physicians. Part of that is, again, they export healthcare, and it gives them a very good name, right? So they go, "Oh, yeah, okay, well they're a socialist country, but they're bringing healthcare to the rest of the world." I mean, it's propaganda, man, and we have to know what it is. But certainly we can all learn a little bit from each other, right? And by the way, I'm my best friend is a Harvard neurologist who's from India. His family originally from Mumbai, and I've been to India many times. I actually fixed Sania Mirza's wrist years ago, and she actually won Wimbledon. The first round she won 9 weeks after I did her wrist arthroscopy. So literally 9 weeks. So
I'll have to tell my friends that I spoke with Sania Mirza's hand surgeon.
Yeah. Last time I saw her was at the Rome Open. Actually, she went on to play a lot of doubles and was the number one in the world for a while with the Swiss girl Katina. Forget her name, but I love India's going through a tough time now, as we all know. So I'm hoping they get through that.
So what can an average person do? We talk about how the system's flawed, it needs rehauling. What could I do today or tomorrow to even inch this forward in the right direction?
I think talk about it. I mean, we have a powerful tool now called social media. So if people paid a little less attention to Kim Kardashian, maybe, and a little more attention to, the struggles they had to get their kid, to the pediatric specialist. If people talked about that would make a big difference. Problem is people don't talk about it. We've just learned to accept it. So now, I want to make a humble request that people at least look at the book, Healthcare from the Trenches, and talk about the issues in there. All I'm trying to do is bring attention to it. There's obviously other books about that. In fact, I researched them. I'm looking at them on my bookshelf now. The Price We Pay by Marty McAree, TRE, The Healing of America. The person who wrote the foreword to my book, Julio Gonzalez, a fellow Cuban-American orthopedic surgeon, wrote The Case for Free Market Healthcare. So for those of you who don't believe in Medicare for All, Where Does It Hurt by Jonathan Bush, who's the nephew of the ex-president, the recent Bush Jr. So these are people who've written books, and I tried to try to make the topic more interesting by including anecdotes and 25 other contributors. So talking about the issues, even in social media, that will get our legislators to listen. I've had conversations with Senator Cassidy, who read the book. He's one of only 4 physicians in the Senate. And he's very passionate about this, obviously. He was in the trenches himself. So that's the only way I think it's going to change. And the same thing that we're seeing now again with these other social issues. And there is change coming, right? We're seeing that. I just don't think we don't need to torch cars or break windows, but we need to get upset about it and talk about it. And nobody seems to be doing that, which it really interests me.
Well, speaking of Kim Kardashian, her former stepfather, now stepmother, she's got some good ideas on healthcare reform, but that's another topic. She announced that Caitlyn Jenner's running for governor of California. But I'm just kidding. You're a big deal.
I still remember. I'm a big Olympics buff, so I love the decathlon. So every time I see her, I mean, I think about Bruce Jenner, who was, to me, I mean, had the world record in the decathlon. That was an amazing
He was
Olympics.
Incredible.
I need to watch it. Yeah,
he was a big deal. Yeah. You're a pretty big deal also. I'm just curious.
Well, my mom thinks so.
You're down in South Florida. Pretty big name within the hand surgery space. Expert on Cuban immigrant. Are you an advisor of any sorts to our Senator Marco Rubio? Because he also is involved in healthcare reform.
Listen, I'm going to be very clear here. This is the problem also. Yesterday, I went to a breakfast with our new county mayor. So let's see how long it takes for me to actually be able to sit down with her. She's a very nice lady. Her husband's a physician. In fact, her husband is mentioned, not by name in my book, when I talk about concierge medicine, because he's one of the originators of concierge healthcare. So that's kind of interesting, right? Our politician who's very, she's extremely liberal, and yet her spouse, obviously saw that there's a problem with healthcare. I mean, you don't do concierge care unless you realize that the health insurance companies aren't paying you adequately, and that's what's happening. In terms of Marco Rubio, his office, senatorial office in Miami, is directly across the street from my center. In fact, when he opened it, I asked my anesthesiologist and the nursing team, hold off on bringing the next patient into the operating room. I went across the street, I put my weight coat on, and I was 10 feet away from him at the lectern when he made the announcement. There's only about 40, 50 people in the lobby of this building, and yet I've never been able to meet with him. I, in fact, scheduled a meeting with him in D.C., and I went, and I did not go because I had just ironically had knee surgery myself, and I was going to go and limp there with crutches, but I didn't go because I knew he wouldn't meet with us. And sure enough, some people from my team went, and we met with one of his aides. So there has been absolutely no dialogue with Senator Rubio. And I know people who know him from childhood, right? He grew up in Miami. He went to Belen. Belen is a school that was in Cuba and was exported to Miami within a couple of years. I mean, it was amazing. It was a prestigious school. Well, Fidel Castro went to a Belen Academy in Cuba, and so many of the power people in the Cuban community have gone to that. Excellent. It's a Jesuit school. So I know people who know him personally. I have never been able to meet him. So I think that tells you something about the challenges in our healthcare system.
Yes.
I'm speaking to a senator from Louisiana, and yet I can't speak to the senator who's across the street from me.
Across the street. Pretty much shares your office space.
And I'd like to wish that maybe somebody from Senator Rubio's team is listening to this, because I'm not disparaging the senator in any way, but I'm just speaking the reality. The reality is I'm trying to do something to improve healthcare from the trenches. I'm not some talking head. I did eight surgeries yesterday, which was a slow day for me. Okay. And I'm talking to you guys on my time because I think what you're doing is valuable, bringing these ideas to the public. The question is, how can we bridge that gap between the people actually doing the work? I'm actually providing healthcare. I'm not some healthcare insurance executive. I am in the operating room fixing people. How can people like me not be able to speak to somebody who's making policy decision that affects our country? I'm trying to understand that.
It gets very annoying because I deal with the same things, not with healthcare, but with other ideas. But let's wrap up this interview by talking about your journey, because a lot of people who don't grow up in like Florida or Texas, where we're from, maybe California, they don't understand the journey that it takes to come here. So tell us your journey of how you left Cuba, how your family immigrated from Cuba to the United States, and what the Castros have done to destroy Cuba when you came here, and what they've done since then.
Well, you have to understand, and I've been reading a lot more now that I don't have to read as many medical books at this point in my career. I've been reading a lot about Cuba. and understanding it better. But bottom line is, people realized very soon that Castro was kind of sold us a bag of goods. Certainly, people didn't like Batista. He became more and more dictatorial, and that was an opportunity for Castro to come in. And there was hopes for him, including my mom was sort of believing in him, and then but my dad and many other people did not. My dad's actually an immigrant from Valencia, Spain. My entire family on my father's side still lives in Valencia, Spain. But my dad moved there when he was 10. And then when people realized that Castro was going to limit your freedoms, eliminate free enterprise, literally would take over. Imagine Americans, if somebody came in and said, this restaurant is no longer yours, this hotel, this business, your medical clinic is no longer yours, it's the government's. So you can imagine that people started fleeing. When I left in '64, I was a baby. You couldn't even leave anymore directly to U.S. because Castro realized the country was going to empty out. And so we had to go to Spain, but not to Valencia. We went to Madrid. We were there 6 months.
You
and then
flew there?
We emigrated.
You flew there to Spain?
We flew, but you couldn't bring anything with you. So you can imagine you have, things you've acquired, whether it be money in a bank, whatever it may be, and you basically can bring enough money to make a payphone call. I mean, people would wear 2 or 3 pairs of pants because you couldn't even bring anything more than a tiny little bag. And there's a wonderful film by Andy Garcia, who's actually a second cousin of mine. I don't know him, but he did a film called now I can't remember. It's not the Magic City.
I want to add this.
I think it's called The Lost City. I don't recall now, but just Google Andy Garcia and movie about Cuba.
Okay.
And he talks about this. So I arrived in Elizabeth, New Jersey, where there was actually a lot of Cuban Americans. Most went certainly to South Florida, but a lot went, surprisingly to people, a lot went to New Jersey for whatever reason. Mainly we knew people there, right? We knew some people.
Yeah.
It's a snowball. And then, and the same thing with the Indian community and the Arab community. They go to certain pockets because they know people. And then my dad was, working, odd jobs, studied engineering at night, had to completely restart his education because he was almost finishing in Havana. And then I'm a public school kid. And I was lucky enough to work hard enough to get into Cornell and university. And I had always had the vision of being a surgeon. So it was a little boring for me. I didn't have this moment of wondering what I'm going to do with my life. I always kind of knew. And, it's a classic immigrant story. So this country is built on immigrants. So I embrace that. But, obviously I think it has to be legal, and that's very important. I don't want to get into that, but certainly we need to come up with real immigration reform, just like healthcare reform. It has to make sense. It cannot be. It's not a partisan issue, right? This is an issue that affects all of us.
So when you fled Cuba, you were a baby. Look, both of us are stay-at-home dads who run businesses, and I'm almost a full-time caretaker for my son, who's only a year and a half. How did you, as a baby, leave Cuba without taking? I mean, you couldn't. I'm assuming your family couldn't take diapers or formula or wipes or
No, my mom started working as a teacher because she had gone to teachers. She had started teachers college in Havana. She got a job here, and then she got a job in healthcare because she was always interested because of my family in healthcare. So without any degree. And then, so my grandparents from Spain actually came basically with us, like right around the same time. So they cared for me while both my parents worked. So that was really how it happened. And that's a typical story. The nuclear family is very important for immigrants because they have to support each other.
Yeah. No, absolutely. Absolutely. Wow. Great story. Incredible story. The website is Dr. Badia, BADIA.com, drbadia.com. Also, surgery center at Doral.com, surgery center at Doral.com, as well as orthonowlive.com. That's the new technology that Dr. Badia was talking about, orthonowlive.com.
Yeah,
Dr.
the clinics are orthonowcare.com, and that's, we're hoping to be in both your cities. We're going to actually be very near you in Tampa soon. I hope. I can't spill the beans, but OrthoNow is going national. So
really,
that,
okay.
that
Well,
should
if
be
you
of
do
interest.
something
Yeah.
in Tampa, definitely contact me. I'll see what we can do. Whether it's our company or some of the nonprofits I'm affiliated with, professional organizations. Let's definitely stay in contact. But any final thoughts or anything else you want to promote to our listeners?
No, I think people will be interested in reading the book. If any of your listeners, think that healthcare needs to be changed and improved, the delivery, I would urge them to take a look at the book. You can get it on Kindle. You can even put it on your smartphone. It's actually pretty easy to read on the phone. I've read some chapters here and there. You just download the Kindle app, and the book is Healthcare from the Trenches. It'll set you back a big $3, the Kindle version, and I think the soft cover is about $19. And if you find it interesting, please comment on it. You can review the book because that gets the interest going. And until the public starts talking about healthcare challenges with the same passion as they do other healthcare societal challenges, we're not going to see a change. It's got to come from the public. It will not come from the current people in power.
It won't come from Marco Rubio.
I don't know. I hope Marco's staff hears this at some point. I'd be happy to meet him. I'll make him. I make a very, very mean cafecito. So happy to.
You should drop off a copy of your book. Just go walk over, sign it, and just drop it off.
That's a great idea. I hadn't even thought of sending it to him because of the lack of engagement. But like I said, I mailed one to Senator Cassidy, and he actually read it. So yeah. I know because when I spoke to him, the things that he brought up in the conversation told me he read it. So we will see.
Very good. Well, thank you, Dr. Alejandro Badia. Thank you so much for joining us on the Work From Home Show. To all our listeners, check out all of our previous episodes at workfromhomeshow.com. That's www.workfromhomeshow.com. If you have any questions or comments about this interview or anything at all, hello@workfromhomeshow.com is our email address. hello@workfromhomeshow.com. Leave us a review on whatever podcasting platform you use. And until next week, keep on working from home.